You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. Hear healthcare that cares. This is Resource Live.
Hi, everyone. I'm Dr. Jonathan Fialco, Chief Population Health Officer for Baptist Health South Florida, coming to you live from the Baptist Health newsroom. Men are prone to diseases that can affect anyone: heart disease, stroke, diabetes, cancers, but they also have unique issues like prostate cancer. The average man pays less attention to his health than the average woman and usually avoids going to the doctor. I know there are a lot of women out there right now who are nodding their heads and the men are wondering what's the fuss, but screenings and a healthy lifestyle are key to prevention and can add many years to a man's life. June is Men's Health Month, and we have with us today a few experts from the Baptist Health family to talk about just that. I'd like to welcome Dr. Michael Swartzen, primary care sports medicine physician at the Miami Orthopedics and Sports Medicine Institute. Thanks for joining us, Michael.
Thank you.
Dr. Ahmed Eldafrari, urologic oncologist at Baptist Health's Miami Cancer Institute. Pleasure to meet you virtually, Ahmed.
Happy to be here.
And Dr. Elliot Elias, who's the medical director of cardiac and structural imaging at Baptist Health's Miami Cardiac and Vascular Institute. Thanks for being here, Elliot.
Thank you, John.
And Elliot is coming to us from the gallery at the Baptist Hospital Cardiac and Vascular Institute Interventional Services Lab. So right on the spot, Elliot. Thanks. Thanks to you all for being here. It's a pleasure to have you with us today. Before we dive into today's subject, I'd like to remind all our viewers to send in your questions and comments throughout the segment. We're here for you and happy to answer any questions. So Michael, let's have you kick it off. We know that many men do put off going to the doctor as long as possible. They don't think of themselves as having medical issues, whether it's denial or the macho component. But sometimes that's even when they're having symptoms. Why do you think, and are there any studies that show why men are less likely to go to a doctor, both for preventive services or even when they may start having any complaints?
For the most part, men very much like to go about their daily lives and not disrupt their routine. Taking off of work to going to see the doctor is simply not something that they typically would want to do. And it's been my experience that most of the time it's either a severe problem or their wife brings them in. And it's really you kind of nailed it before. I think some of it is cultural and some of it is just upbringing.
So Michael, so do you see in your practice, in primary care within Miami Orthopedic Sports Medicine, do you see men coming to you that it's kind of like, dude, what took you so long, or why'd you wait so long? Are you actually seeing that in your practice?
Basically, people will come to me when all the things that they could try at home have failed, and they're limited with either their activities at work or their activities for their weekend warrior, their tennis, and they're really not interested in stopping what they're doing. And so it's really only when the problem becomes severe that they're limited that they show up.
Appreciate that, Elliot. Cardiology standpoint, but again, this is general. Again, we said men tend to avoid going to the doctor. They can sometimes ignore unusual symptoms that you might look at and say, hey, why are you ignoring that? What are the kind of things that men should be aware of, even those that feel relatively well, that might negatively impact their health as they get older?
Yeah, so as cardiologists, our favorite type of medicine practice is preventative medicine. So for those patients that haven't quite reached us in clinic, we try to identify for them those risk factors that are both modifiable and non-modifiable for prevention of coronary artery disease. So the typical ones that we focus on are high blood pressure, cholesterol, obesity, physical inactivity, diabetes, and we always, of course, know that we want to encourage everyone to promote a further healthy lifestyle, such as not smoking and limit their alcohol abuse.
So those are the big things that would be part of just a general checkup and things that a man should be aware of to determine, are they at risk for medical problems? And I think it's important to point out, of the ones you mentioned, high cholesterol and high blood pressure don't produce symptoms. So people will not know if they have those medical conditions unless they get checked out, whether it's they check their own blood pressure or have someone check it or get blood tests to look at their cholesterol. So that's great information. Ahmed, what about screenings? We look at, from the cardiovascular standpoint, we look at these blood tests and various other measurable things. And for screenings, I think it's also very much relevant for those things as well as cancers. So what are the kind of regular screenings that we generally would want a person to have as part of their medical care?
So from a urologist standpoint, every man at the age of 50 or older could be screened for prostate cancer. And this is done very simple by a simple blood test called PSA, or prostate specific antigen. And that test tends to be higher in certain conditions like prostate, inflammation of the prostate or the bladder. But more importantly, it's elevated for prostate cancer. And not only with PSA, we also do a rectal exam where we feel the prostate, and either one of them is enough to trigger more investigation to look for prostate cancer. So an abnormal exam or elevated PSA, which they should be done once a year.
How about women also get mammograms and pap smears? Men, as you just mentioned, we're looking for prostate cancers. Can you speak to colorectal screenings and other things that, again, the benefit of screening in detecting something early to improve the survival rates? Isn't that kind of the concept of screenings in the first place?
Good thing that you mentioned. Yeah, good thing that you mentioned the breast cancer. So the prostate correlates exactly with the breast in women. 1 in 6 men get prostate cancer, 9 women get breast cancer. And that's why we screen for them, because they are very curable diseases. Other cancers that we screen for is colorectal cancer, as you mentioned. And by the way, they are also tend to be higher incidence in men than women. And in that, they get colonoscopy at the age of 50, start at the age of 50. And patients with family history of cancer, colorectal cancer, they get screened earlier, 10 years before the age of diagnosis of the relative.
So the benefit of going to your doctor on a regular basis, annual checkups, determining when it's appropriate to get the screenings. It's not the same for everyone. Your family history might affect the recommendation to you. And we certainly want to always individualize the recommendations as we just mentioned. So that's great information. Michael, let's kick it back to you regarding exercise. Couple of things that I think your expertise can bring to this conversation in terms of not just what would be recommendations for exercise for men, especially as we get older, but what can a man expect from their ability to exercise? I see it a little bit because a lot of times when a man's conditioning decreases over time, they may think it's a cardiac condition. What would you recommend in terms of general statements regarding exercise in men? And then secondly, what can one expect as they age regarding their exercise ability and performance?
These are very, very important questions or topics. Exercise is a very key ingredient in how we move forward and prevent cardiovascular and other issues that men have. Men will get frustrated just like women as they age. Things just won't work exactly the same way. The aging process is very difficult. It's very individualized, but overall, most people will notice that their muscles become a little weaker, their body becomes a little tighter, and so the warm up and cool down period becomes a little bit longer to maintain the same flexibility and strength. There's articles all the time that are coming out. The main guideline that we use from the American College of Sports Medicine is 150 minutes a week of cardiovascular exercise and 150 minutes a week of resistance training. This is very important for men. You worry about blood pressure, you worry about erectile dysfunction, you worry about being able to sustain in your life. If you don't use it, you will lose it, and it'll be so much harder later. And there's constantly studies that show that middle age is such an important time for you to engage in moderate exercise activity.
I think that's great information, and all the points you made are really critical for anyone, but certainly for a man. Can you speak a little bit, you just mentioned if you use it, you lose it. Can you speak a little bit, and again, just from the expectations such that, you know, a 20-year-old athletic person who might get away from exercise a few weeks can kind of get back into it. If someone's going to either start exercising or they got away from it and got back into it as they get older, both precautions and expectations in terms of age-related conditioning. Can you speak to that a little bit?
Yeah, so there's this kind of fallacy that if as you get older you have to be weaker and you have to be smaller. That's not necessarily true. You can maintain a lot of your cardiovascular fitness level and a lot of your strength. You see a lot of marathon runners are older, and you develop that kind of veteran savvy. And so it really becomes not only physical but mental. You need to create the time and vary your routine to continue to exercise. And you may pick up an injury or two on the way, which may mean you need to adapt, and instead of, you know, high impact long distance running, you switch to cycling or swimming. You have back problems, maybe you need to do some Pilates. So certainly you need to be open to varying your routine, but you have to keep pushing. If you don't overload the system, you won't continue to maintain what you have.
I love that last comment and concept. How often do I see, and again, I'm sure you see it even more, you know, a man, middle-aged, a little bit older, might have had their routine, fairly fit, and they hurt their knee, they stop exercising, they gain weight, and they say, oh, but I couldn't exercise anymore, I hurt my knee. And I'm like, well, there's lots of other things you can do that, you know, will spare your knee and whatnot. So adapt, find out, you know, what your body can handle, age-related. I think those are great recommendations, and I think people should recognize that.
And don't forget to adjust your diet as you're exercising less, right? Because the snowball effect that I see is people have a minor injury, they'll rest, then they gain weight, then their knee or hip will hurt more, and then they exercise less and they gain more weight, and then all of a sudden you used to be a very active person and now you're not, and it's very hard to you know, go back the other way.
Again, I love these comments you're making. I appreciate this dialogue. It's very true. You can't exercise your way out of a bad diet. If someone has a certain level of age and nutrition and fitness and they're a certain weight, you break that, you take a variable out, like they're not exercising, they gain weight. They can't just resume the exercise and get back where they are. They have to alter their diet appropriately.
Absolutely.
So great advice. Elliot, let's turn it back to heart disease. Obviously, all these components are very much related. You mentioned the risk factors, the things that someone may look at or be told, hey, you have this, it could lead to this problem. Let's look at it. What can men do to stay on top of their heart health? Exercise, of course, and you know, as Michael mentioned, is extremely important. What other things would we be recommending to men as part of their general health in avoiding heart disease?
Yeah, so again, as we talked about, modifiable risk factors, exercise is great. Diet again comes to the forefront. Lowering cholesterol even through diet is ideal, and even stress and ways to decompress, I think, is something that's a big risk factor that we don't always see, and it's difficult to think about. But if you don't have time to release stress and whether it's work or other issues that are going on, then the blood pressure creeps up. And so, of course, we'd always like to treat something without medication, and that's something that I think goes under the radar.
You guys have obviously been listening to our Baptist Health podcast because we've had a lot of these subjects regarding that. But yeah, you know, a proper diet, avoiding inflammatory medications, high starch, high carbohydrate, inflammatory medications, keeping your cholesterol down, exercise, stress avoidance. It's not easy, but it can be managed. Sleep, we've talked about in the past, getting a proper night's sleep. So these are great recommendations. Elliot, I'm going to put you on the spot a little bit. Which I've certainly done in the past. Let's talk about the coronary calcium score a little bit. The coronary calcium score, it's an incredibly safe and inexpensive and easy to attain test, which gives us a lot of information, but it's certainly fraught with a lot of inappropriate use or people getting wrong information from it a little bit. The coronary calcium test was actually developed by radiologists who in the Baptist health system, going back over a decade ago. It tells us about, well, actually, why don't you tell us what is the calcium scoring about, and what are the kind of situations where a man would benefit from getting a calcium score?
Yeah, sure. So a calcium score is a powerful tool that we use for risk stratification in our asymptomatic patients. Now, I think a lot of confusion lies in the fact where you would think that if you got a score, then you would know how much blockage you have in your arteries. But really what you're focusing on is the amount of calcium in our arteries. Now, we know that calcium is a marker of coronary atherosclerosis, which predisposes you to heart disease. And so what we do with the score is quantify that amount of calcium. And based on the amount of robust data that we've had over the last 20 years, we're able to risk stratify our patients based on their age, sex, and even ethnicity. And then we combine those with some of the other risk factors that we mentioned, and then we're able to appropriately classify them as either low, intermediate, or high risk. And I think it's a great tool that allows us to give a patient-centered treatment approach with a high amount of weight behind our treatment plans.
Well said. The calcium score helps guide the clinician as to what's your risk of a cardiac event so we can appropriately lower the risk. It's not an indicator of blockage or, you're going to have a heart attack in the near future. I remember when calcium scores first came out, people were getting them and they'd get a score and they'd run to the emergency room thinking, it was something really bad. It's just a risk predictor. Who should not get a calcium score? Again, I've seen people who've had bypass surgery and they come in and say, should I get a calcium score? The calcium score is meant to tell me what's your chance of having coronary disease that could lead to a cardiac event. Well, you had bypass surgery. I kind of think we know you have coronary disease. So where, can you speak to maybe where it doesn't help? And maybe second point of that, what if the calcium score is 0? What's the power of that score of 0?
Sure. So I'll answer your second question first. I had a patient recently, and his father and uncle actually died prematurely of coronary disease, which is before the age of 55. And he was considering, actually he wasn't considering, he already put himself on a statin medication. Now, granted, his uncle and father smoked a lot and drank a lot, which we know are modifiable risk factors for coronary disease. But we decided to get him a calcium score, and the calcium score was 0. And while he was on that medication, before the calcium score, he was having a lot of myalgias or muscle pain. And based on that calcium score, we made a joint decision to take him off that medication. So in short, to answer your question of what is the power of 0 for a calcium score, we know that there's no proven benefit to treatment when a calcium score is 0.
And we repeat it in 4 to 5 years. So it's a moving target. The calcium score says, what's my risk of a cardiac event in 10 years? If it's 0, my risk is low. I'll come back in 4 to 5 years and repeat it. If it's 0, my risk is low. I'll come back 4 to 5 years. If it elevates, then you have time to do something. So again, very, very well said. Ahmed, switching gears a little bit. Again, these are the things that we as men have to deal with, and certainly our counterparts outside of this call have to deal with. You mentioned that prostate, colorectal, lung, skin cancers, very prominent in men. Let's talk a little bit about the prostate. What is it? What does it do? What are the symptoms or signs a man may have that should warrant them getting a follow-up regarding to any prostate problems? You mentioned screening with PSAs. I think you said 50. So I know I give a lot of questions. So what's the prostate? What does it do? When should men start thinking of relating a symptom to it?
So the prostate is a gland. Its location in the bladder and the urethra. So exactly at the junction between the bladder and the urethra. And the urethra actually runs through the prostate, in the middle of the prostate. The function of the prostate gland is to secrete fluid that provide nutrition for the semen, for the sperms to survive, survive their journey to the That's the only benefit for the prostate. So it's beneficial for young fertile men. Two main issues about the prostate and the problem can arise from the prostate in men. One is a larger prostate and voiding problems from the prostate, which a benign condition when the central part of the gland grows. And till today, no one knows why this part starts to grow with age. Men usually start to experience symptoms with weak stream, having to wait to start urination, having to wake up at night to urinate. And this is a benign condition. It's not cancer. It's just the prostate being larger. And since the urethra runs to the middle part of that prostate gland, it kind of narrows the stream and puts some pressure. And for that, there are treatments. There are medications we try. If the medications fail, we resort to surgery if the symptoms are bothersome to the patient. If there are mild symptoms and doesn't bother the patient, we do not do any treatment. That's for the benign part.
So I think I just, again, I'll let you finish, but again, people know there's prostate cancer, which is a particular abnormality, as you mentioned, and the PSA blood test and the digital exam. You're talking about much more common prostate related concerns that a white man experience, which is not cancer related. So I just wanted to clarify that as you go on. So I'm sorry, continue. Yes.
Yeah. The
Only because
second problem
you were dropping out a little. You were dropping out a little bit there. That's why I wanted to clarify. I didn't mean to.
Okay. So the second problem that we need to address is the prostate cancer. And prostate cancer arises from the peripheral zone of the prostate, which means the outside part of the prostate. And like we said, 1 in 6 men get prostate cancer. And in general, prostate cancer is not an aggressive kind of cancer, which can take many years to spread or kill someone. And with that being said, it's very curable if detected early. And being the most common cancer in men and the second most lethal cancer in men, we try to detect prostate cancer as early as possible and treat it and cure it if we detect it early. And for that, we screen for prostate cancer by the rectal exam to feel if any nodules or hard areas of the prostate that could be concerning for cancer, or the PSA test, and if it's elevated, or abnormal rectal exam, we first do usually MRI or magnetic resonance imaging of the prostate to look for what cancer, and we could do a biopsy of sample of the prostate within.
Excellent. Great again, great clarification information. So Michael, turning it back to you. This is actually a question I'm probably the most interested in answering, only because, again, receiving a lot of these questions as well. Testosterone, low T, lots of marketing stuff out there. So first place, again, what does testosterone do? You know, important for, again, muscle, bone mass, helps libido, stores fat. You can get into whatever level of detail you want regarding what testosterone does if you're comfortable. But the real question is, what happens naturally to men's testosterone levels as we get older? And then when would it become a pathological condition where it should benefit from actually being treated or replaced? Can you speak a little bit about, you know, what your experiences are regarding the
absolutely.
testosterone? Yeah.
You know, low T is certainly in fashion, right? I listen to Sports Talk Radio, and every segment there's a commercial for it for someone. There's magazine articles. Here's what I'll say. Testosterone is a hormone that's really what gives you your manliness. There's no doubt about it. It peaks, you know, it starts shooting up at puberty, peaks kind of in your early adulthood, and then starting at about 40, you lose 1 to 2% per year. So as you age, there may be some symptoms that you notice, such as decreased libido, decreased muscle mass. Most of these are a normal part of aging, which you can counteract with, like I said, the exercise and other issues. Now, here's where the problem lies. A lot of times people have issues that they'll blame on testosterone that are really a function of a chronic illness, stress, alcoholism, obesity, which all those things actually also reduce testosterone. So you have people going to the doctor asking for testosterone treatments, thinking that's going to solve their problem, when really there may be other factors at play that are more likely responsible for why they're feeling what they're feeling. Certainly, it's a reasonable blood test to take, but there's probably 1 million people on testosterone treatment, but it's not the easy solution. There's no shortcut, right? And so, as much as it may seem to be an easy way out, there usually is another reason why you're having the erectile dysfunction, and it's probably more diabetes and exercise related than your testosterone. Does that make sense?
It's phenomenal. I love it. I should record it and put it in our cardiovascular offices as well. Testosterone is a fat soluble hormone. It's made by the body. We gain weight in the belly. The testosterone we make gets partitioned to the belly. So we're not making it. It's just being sucked up somewhere else. And you talk about these lifestyle things that will lower your testosterone. It's obviously better to improve those lifestyle issues, and your testosterone will normalize than taking the supplement. But as a follow-up to that, and it's a little controversial, so I recognize, I'm putting you on the spot. If someone gets put on the testosterone replacement that really is not deficient in testosterone, it's secondary, their levels are low for other reasons, is there a danger to that?
There is, certainly we had some guys talk earlier, some of the physicians here talk about prostate cancer. More rarely people have breast cancer. If you start taking testosterone, you could be hastening a problem that you're unaware of. You could change how your red blood cells, you could become, your red blood cell count could be much higher. You could develop sleep apnea. If you're thinking about becoming a father, that could affect how you have children. If you have heart issues, it could affect that. And certainly there's issues with possible blood clots and other issues. So never a good idea to mess with a system that the body has going right. The body knows its homeostasis or how to balance what levels you're at. The minute you start taking it by mouth or injecting it or patches or gels, you mess up your body's system, and there are risks for that.
I love it. People want the quick fix, get a little older, don't exercise as much, gain a little weight, drink a little more. Oh, let me take testosterone and it'll make it all better. And there's obviously consequences to it. Man, you guys were really awesome. I really can't tell you again. I always love learning from our guests, and hopefully our listeners got a lot of great information that they can use as well. A couple of minutes for a couple of quick questions. Again, that are coming in. Elliot, quick question. Should a man get a regular stress test? Should a man get a stress test regularly?
And the quick answer is no.
I love it. Right. Not a screening test. It's when you have symptoms, you don't know what they are. But yes, there's no reason to say it's time for my stress test. Or good. All right.
Exactly.
I set you up, but it was a good answer. Michael, what are the more common, if this is a fair question, what are the more common orthopedic issues that you see in men as they get older?
Probably the most common thing is arthritis. You may have had an athletic injury or a car accident when you were earlier, or a surgery for something minor, and then the post-traumatic or issues that can arise from degenerative problems over time. So I think that's probably the most common thing I see is arthritis, which unfortunately we don't have a cure for, so we work on management for that.
Ahmed, last question. Is there really such thing as a male menopause?
Like the decline in testosterone is very, very slow. So in reality, no.
Good enough. Other hormonal things occur, but it's not analogous to a menopause. Really, guys, great conversation. I really appreciate your time and everything you dedicate to your patients and to the Baptist Health System. And really, thanks for sharing all your insights today with the audience. Remember, viewers, you can connect with us on our social media channels. That's Facebook, Instagram, Twitter, LinkedIn. And check out our resource blog for the latest news at baptisthealth.net/news. That's baptisthealth.net/news. You'll find a link there to all the episodes of the Baptist Health Talk podcast as well. On behalf of everyone at Baptist Health, we ask you to please stay safe and say yes to the COVID-19 vaccine. Thank you.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida. Healthcare that cares.